Hi everyone, good afternoon and welcome to the first Heartist meeting in Rome. This is the second episode of In Conversation with Knight. We are here with Professor Vasilios Tanos, who has accepted our invitation for some questions regarding the kingdom he belongs to in the battlefield for the Fertile Patient World Cup. Thank you, Professor Tanos.
Thank you.
First question would be, what is the kingdom you identify with, if there is only one, and effectively what is it?
Yes, actually I do a lot of hysteroscopy and ultrasound, of course, to my patients, but I do also IVF many times.
So you embrace the three
I
of them?
embrace all three of them, yes.
Thank you. The second question would be, what is the best weapon as a procedure or as a technique in the kingdom you have the most of your activity in? So in this case, just identify one.
It is generally accepted that we start the workup with ultrasound. So ultrasound is very important, and nowadays we have to know also very well to apply the 3D and 4D ultrasound. Together with hysteroscopy, you can identify the big majority of the problems in infertility patients.
Perfect, thank you. Third question is, if you could fight only for one update or modification in the latest recommendations for the uterine factor, what would it be?
Well, there are many colleagues, they don't believe yet that in those patients suffering from infertility and they have septa, congenital uterine anomalies, they still believe that it's not important to undergo surgery. In my opinion, we should have prospective randomized studies and try to persuade these colleagues that indeed it's very necessary to those patients that have infertility problems to undergo septectomy, hysteroscopic septectomy, or T-shaped uterus correction, of course.
Perfect, thank you. Next question, I think we have already covered it. What is your unpopular opinion in your kingdom regarding the infertile patient management?
I think today we are missing the fact that many doctors are extra specialized either in ultrasound or in IVF or in hysteroscopy, but we are missing the doctors that they have knowledge and clinical practice in all three of these subdisciplines. And I believe that it's our responsibilities to teach these young generations and to incorporate in their clinical management the knowledge as well the hand skills to deal with all three, ultrasound, hysteroscopy and infertility patients.
Perfect, thank you. Next question is, what is the most medieval practice that you still see ongoing in your kingdom?
I think DNC. I think DNC should be prohibited. It's not acceptable anymore to do this blind technique in patients that they have infertility problems.
Thank you. And the next question is, for the purpose of the win, that is reaching the fertility outcome for the patient, who is the strongest partner for an alliance among the other two kingdoms?
Doctors that are dealing with IVF, I think they have a problem today because they don't fully accept the routine hysteroscopic surveillance to patients prior to IVF treatments. So I would challenge them very much to come and see the results in our center, to go and see together the results in other centers that it's a priority to do hysteroscopic prior to IVF treatments.
Thank you. And the last question, a bit provocative, would be, if you could challenge or duel only one knight, who would he or she be?
Well, it's difficult to say a name because unfortunately many of our colleagues dealing with IVF they have not been persuaded yet regarding the importance of hysteroscopy. Indeed, we have problems with the literature, and the prospective randomized studies are very limited, and those that they publish already, they have many problems. But you know, in the reality, what we are facing today, and this is the problem with our patients, because the patients are coming and they are asking to have a baby. So that's the real question to ask. What do we do with these patients that they have problems? Shall we do multiple IVFs, or we have to spend some more time in investigating the reason, the cause of the infertility problem, to identify really all the details and then to proceed with diagnosis?
Perfect. Thank you very much, Professor. Thank you.
Thank you.